Many Americans view health care as a key issue in the upcoming elections. Gallup talks to former Senator Bob Kerrey and former House Speaker Newt Gingrich on long-term care, an issue they believe is going unaddressed. Former Speaker Gingrich and former Senator Kerrey head a national commission addressing long-term care, an issue they believe is critical to the health and financial security of all Americans.
You begin to realize how really important it is at the most human of levels to have the right investments in health, to have the right system of care, and to maximize the chance that your mother or your father or your sister or your daughter can actually have access to that kind of care.
A recent retirement confidence survey found that 72% of Americans do not have long-term care insurance at all, and only about half of Americans are confident they will have enough money to pay for long-term care.
I think you have to begin by saying an individual has responsibility here and delineate what those responsibilities are. And then you have to say, okay, what's the government's role? And I think the government's role has to be, personally, in creating some kind of a safety net that's portable, that creates a universality, that relieves the states and the burdens of having trying to figure out what to do with their Medicaid costs. And obviously, thirdly, you've got to have some kind of a program that encourages people both to purchase private insurance for long-term care, but also encourages them to save the money that they're going to need, as we all get not just older, but we live longer.
Gallup recently asked Americans to name the biggest health problems facing the United States today. Access to care and cost of care topped the list as the most urgent issues.
These healthcare problems have become expensive problems, and as a consequence of that, the increases in cost for healthcare have outstripped inflation and outstripped productivity, and as a result, it's become a very, very big issue for working families.
Both Kerrey and Gingrich believe that none of the presidential candidates are taking a stand on long-term care, which could concern many Americans who, according to Gallup, think healthcare in general is the third most important issue facing voters.
None of them in either party have yet really addressed quality long-term care and the issues of the frail elderly. And that's something I hope that whoever the nominees are, that we'll be able to work with them starting in April.
I sat down with editor-in-chief of the Gallup poll, Frank Newport, to discuss how the candidates' healthcare platforms will affect the race to the White House. Now, according to the polls, which candidate has the strongest healthcare program right now?
Well, a couple of months ago, we asked which candidate would do best, and it's Hillary Clinton by far over Barack Obama or John Edwards. On the Republican side, no winner. We found that Rudy Giuliani and Mitt Romney and Fred Thompson even all were virtually equal. So at this point, there does not appear to be one Republican candidate who has staked out, so to speak, a real strong positioning on health care.
Now, Bob Kerrey and Newt Gingrich also said that none of the candidates have a plan for long-term care within their health care policies. Why do you think this is happening?
The candidates respond to what they think are the concerns of voters, so maybe that reflects kind of what we're finding, that we're not seeing any at least overt clamoring on the part of the American public for dealing with long-term health care. But if they hear about it, if they start getting letters and lots of people are asking about it, trust me, the candidates will come up with platforms on that issue.
I'm Yasmin Vasugian, and join us again to hear more voices from around the world.